Hi, welcome everybody. Great to be here today on World Health Day and looking at this panel, which is looking at the Indian healthcare scenario, challenges, and what's the future we see. I'm Ravi Vidmani. I run Credi Health Private Limited, and I have a team of esteemed panelists with me, and I'd like them to introduce them to all of us. So, Vikas, why don't you start?
I'm Vikas Chauhan. I'm from 1mg.com. It's India's largest e-healthcare platform, and we're trying to bridge the gap of the healthcare inefficiencies and the service gap which exists in the country. Gautam.
Thanks. Yeah, great to be a part of this panel. My name is Gautam Chopra. I'm the co-founder of Beto. We are a full-stack platform for diabetes. And yeah, look forward to having this meaningful conversation with the rest of the panel.
Arushi.
Hi, I'm Arushi. I'm co-founder of FitPass. Happy World Health Day to everybody. So FitPass is basically your one-stop shop for anything fitness related, whether it's to work out, whether you need a nutritionist, whether you need to purchase supplements, everything is available on the app. And I'm very happy to be a part of this. So let's hope we make a lot of changes in this world.
Thank you. Hi, I'm Ambar Srivastav. I'm the founder of Rig Nanosystems. We are a bioelectronics-based startup. We make a lot of medical diagnostic to quantify yourself.
I think healthcare, we need to see how technology, how do we use technology with purpose to make the human experience better. I think that's the challenge we see ahead of us. And when we see healthcare, especially healthcare in India, it's a fairly large value chain. So we have people who manufacture X-ray and PET scans right up to Patanjali. Everybody thinks they're part of healthcare. It's about $800 billion industry, and I think the people who are sitting here, they cover about 60% of that. So $650 billion industry, which is growing at about 17-18% CAGR. So all our panelists here are playing a crucial and critical role in the healthcare value chain. And let's see what in store is there for their future and the challenges they face. Interestingly, about 3 years ago, there were companies like 1mg, Librate, Practo, Credi Health. All of us are being clubbed together, and people didn't know how to differentiate. Over the years, as most of us have evolved and grown, we have now created a niche for ourselves in different, and people now know the industry, the suppliers, and the customers know what is each one known for. And I guess the same will happen with the organizations who are on the panel here, who are relatively new in their startup phase. And I think I would like to say that I would like to hear just a little soundbite, little 1 minute from each one of you, that what's the problem you're solving, and then what is the challenge you see. So before I get into some other thematic topics. So this time maybe we can begin from this side.
That's one of my most interesting question. So we believe that human evolution is the key to human evolution is better quality of life and living longer. Think about a factory having a lot of pipes and boilers and having no pressure gauges or no sensors. And every time a pipe or a blower blows up, you go and fix it. That is how we see healthcare as. We are the guys who are building point of care, home-based diagnostic devices through which you can predict any undue, any healthcare eventuality much before that actually really hits you. So in the core, we work in the area of bioelectronics, and using that, we are developing medical diagnostics, home-used personal medical diagnostics to monitor yourself, to screen yourself, to prognose yourself, and of course, to diagnose yourself. Thank you.
So to some extent, I feel that there's this misconception that most people have that healthcare is about going to the doctor, having some medicines, going to the hospital. When we were in school in class 3 or 4, we were taught that health is actually a physical and mental well-being. So we preach, but we don't follow that prevention is better than cure. So we're actually working towards preventing any healthcare issues, healthcare like I used it in the wrong sense now, healthcare issues that might occur. So if you keep yourself fit, at the end of the day, you will not actually need to go to the doctor, and all, might still, but that's what we're trying to prevent over here. So we're into fitness, we provide nutritional services. If you eat right, you work out, you will at least lead a healthy, happy life.
I think it's interesting that I follow her because, in fact, what we are trying to do is, in fact, solve the problem that India is going to soon face. We will, of course, have 100 million diabetics by the year 2030. And unfortunately, there's a lot of pressure which is coming into the entire healthcare ecosystem on all stakeholders to find solutions and special focus and cater to this large demographic. And that's essentially what we are going to be doing. We are building out this one-stop shop for people with diabetes, where they can sort of fulfill all their needs under one roof. And it really begins with proper monitoring, education, compliance, and of course then changing the consumption pattern of a person having diabetes with healthier alternatives. So that's what Beto is, that's the problem we are trying to solve, and hopefully we will be successful in that.
I think I'll just tell one story, and it's very, very close to me. And these are the examples which we have learned from our consumers, which motivate us to do what we do every day. So this happened in Mumbai. I was sitting with one of the pharma MNC, and there is a senior professional there, and we were just giving demo for our app, and we're just trying to figure out what synergies we can work out. And she just happened to mention that her mother is suffering from an asthma attack, and they went to the doctor because she'd been in the industry for so long. They knew the best doctors in the city, so got the prescription, got the medication, but for 3 days her condition was not improving. The weather was clear, there was no dust in the house. So we type in the medicine name in our app, and what our app does is give you all the information related to that. It gives you clinical information, salt information, do's and don'ts, interactions, and we picked up and developed content from doctors who've been writing this medication for over a decade. What is their do's and don'ts or guidance to their patients? So we typed in the medicine name. In do's and don'ts, one of the elements came up was this medication interacts with potassium-rich foods and fruits. Her mother's favorite fruit was banana, and that was interacting with medicine. Now this simple thing got overlooked, and was it interacting with patients' healthcare journey. And that is what our app or our service does. We make healthcare accessible, affordable, and available to the billion Indians. We try to bring in efficiency which doesn't exist in the healthcare delivery system, and we try to bridge the gap which is existing in the service gap, right from diagnostic, pharmacy, e-consult, or health records. We're just trying to bridge that gap for making it accessible for everyone.
Great. So I think all of us are trying to understand our customer segment and see what we can do for our customers much better. So I must share with you, the panelists, that PwC just took out a global survey on insight of the consumer, about 2 weeks ago. This survey is across 12 countries, and 1 or 2, 3 highlights are very striking. That 64% of Americans feel that companies are losing the human touch while dealing with their customers. 71% feel that they want to talk and work with a human rather than a chatbot. So, and the survey also shows that we need to use technology for 4 things: for convenience, for speed. Consumer today wants it now. So speed, convenience, information, and friendliness. So we need to see how we use technology through unobtrusive platforms to cater to these needs of the consumer. Because sometimes there was a lobby coming up that robots are going to take over mankind. Well, that's not what the customer is thinking. So we need to keep these 4 things in mind, that how do we go ahead to do that. And with that, I want to take you folks to the first discussion point I'd like your views on, which is that, the kind of diversity and variety amongst the businesses of this panelist are that maybe there is a consumer or set of consumer who will experience and consume our service one by one or even simultaneously. And that consumer is feeding in and giving in his data to each one of us every time. So how can we make it more convenient that he doesn't have to repeat that data every time? Can we all share it? Can we network? This is one perspective I'd like you to think about. The other perspective, if you get into serious healthcare delivery, there is a need for digitization amongst hospitals for data, from one hospital to talk to another data, so that we can go from one hospital to another hospital for treatment in a seamless manner. That doesn't happen. That needs to happen. So there are three ways which I'm saying where more information needs to be shared. One is that can we all share it? Second is within hospitals. And the third is, why don't we publish medical outcomes and success outcomes in our country? So if these three on one side, we are seeing such a big hue and cry nowadays with Facebook and Google on data storage, data ownership, data leakage. And how do we marry? On the one hand, it's good to share data. On the other hand, we are seeing the evils of data sharing. And then we have Disha coming along sooner or later. So there are these three things which are kind of playing on the area of data. So I thought I'd like to hear your views. What are your views on this? And is it a challenge, and how do we navigate this challenge? So any one of you, maybe you go first.
So that's a very interesting question. I think in terms of so what you're essentially talking about is electronic medical records. Now, if you're pushing, so a lot of agencies, a lot of countries have actually tried to push hospital infrastructure or healthcare infrastructure to publish their data, share the data, unify their data formats, exchange it in the similar format. They've even in Europe they've even tried to come up with a singular protocol. In fact, in many countries they've actually been successful in pulling this off also. When it comes to, but as we see, as it is very apparent from the society, the control on data, the control on healthcare as a whole, as a sector, which used to be around a decade back, which used to be very firmly around pharma companies, it is slipping away from pharma and shifting towards patients, or say shifting towards consumer, which is exactly the phenomenon which we've seen across any industry for that matter. With time, the control has to go to the end consumer. Now the point is, if you have to generate data, the data has to be generated by the end consumer himself. Now the key question here is, how do you motivate, how do you encourage an individual to generate his data? One happily hops on to a Facebook to build a Facebook account and a LinkedIn account, but how do you encourage a teenager, for example, to create his own account and track her parameters, or build his or her own medical history or repository? That's the key challenge which is needed to be cracked. There are many ways one can actually do that. There are many people who are actually doing that. Gotham, for example, is actually motivating diabetic population, which is a niche population. They need it. They need that data. They need that consistent, customized solution and and advisory. So there are solutions coming up for different healthcare niche segments. But when you talk about a centralized EMR, you're basically essentially talking about the entire mankind as a whole, the entire population as a whole. And for that, we'll have to look at fit well, not unwell people, and how do you kind of pull them up or attract them to that kind of a platform where they themselves start recording data. We have multiple ideas, but I think I'll give more opportunities to the fellow panelists to kind of shed more lights onto it.
Kind of adding on to what Amber said over here, so you do need to motivate people to start maintaining a record, only then can we actually share it. And something that we've realized is, at least in the fitness sector, that you have to motivate and incentivize the customer to actually start taking care of themselves. That is what the Indian market currently is, that when it comes to actually working out, it's, you need it, but you want something else apart from just actually waking up and going to a gym or a studio to work out. So if we can figure out how we can create an amalgamation of incentivizations, that okay, so if you work out, this is what you will get. If you work, like, whatever, if you've achieved this much, maybe you'll get something else, because Indians do want ki aur do, aur batao, like Amazon's ad said, aur dikhao, that is how the mentality is. And that is something that we are now getting into, of how we can incentivize a customer to actually work out and look into, okay, this is what I need to do, this is what I will achieve. Apart from actually being healthy, I have more things that will work in my favor.
Good, that's a great point. Incentivizing, and also how to make it fun. because Indians don't go to a dentist or they don't go for preventive eye checkup, which they should be doing. You know, but the new millennium is moving towards that direction, where prevention and wellness is becoming important in their lives. So let's talk. How does data affect you?
I think, to your point, I think it's there's a fine line between when a company can actually exploit data versus when they can actually use it for the betterment, especially in the industry we are in, for the betterment of the patient in this case. I think the onus, as we've seen in Facebook or of Google, etc., the onus really lies at the end of the company. We need to be more responsible as organizations, because at the end of the day, the customer, and especially when we're looking at the Indian demographic, is not necessarily well equipped to understand how that data, or at least today, they're not well equipped to really appreciate and understand how the data is getting used. So we have to be able to communicate more proactively as organizations, as companies, why we are collating or why we are taking certain amount of their data. For instance, we record blood glucose levels, etc., of the consumers. We ask them for their phone numbers for OTP verification, etc. But we need to be able to inform the customer better of why we are taking the data and what are we going to be doing with them, with the data, and what we are not going to be doing with the data. So I personally feel, I think there need to be a certain amount of responsibility at the end of the companies, but also stricter regulations, and unfortunately in India we don't have many yet.
Yeah, that's a great point you make, Gautam, that between exploit and leverage, you know, and I think two things come in between: ethics and policing. Yeah. You know, so do our ethics come in the picture between exploiting and leverage, and is there enough policing in our country? Yes, Vikas.
Yeah, so I think I echo what you all are saying. I just take a step back, and I think what fundamentally we miss today is defining data. Health data in itself is a vast ocean, and what we today talking about are the symptoms. So what fundamentally I believe is this gets bifurcated into three parties which are participating into it. One is the consumer, the other is the service provider, healthcare service provider, in which we all are there, and the existing system of hospitals, clinic, polyclinics, primary health centers, and everybody is there. And the third element is of the regulatory, and I'll just share what I think about each one, how they see it. I think fundamentally, if you look from a consumer perspective today, he is exploring a new definition of care. He is exploring a new paradigm shift of offering which is coming to him. Maybe it is restricted to the urban population today, which is likely 1/3, and 2/3 is still not affected, but that is where the role of technology and that is where the role of all of us come, that how can we extend this services, this benefit of services which a consumer understands and consumes in urban population, and it goes towards the 2/3 of the population which is left. So for him, for a consumer, which is consumer like any of us, the data is data. And health is holistic. So nobody would want that my health data is prescription data, my health data is diagnostic data, my health data is my steps, my health data is my diabetes information. And he really don't understand that. He says it's a data. It is a responsibility at our end as a service provider, and which is my next party to this, is how do we understand and bring this data at a common platform which can be used, as Gautam rightly mentioned, that it becomes for the betterment of the society. If we don't do that, then we're not playing our part into it, and that is something I'm not saying will happen in 12 months, but that is something we'll have to look at. So so then the third party comes into the play, which has an important role to play, where how you define an infrastructure or a guideline in which data sharing between parties, data storage for a consumer, and how it is being shared, used, analyzed, and protected in a format where the consumer is also protected, the health service is also protected, and the benefit which can be drawn out of it can be protected. So for example, we collect a lot of data, which is, say, blood test data or medicine search data. And the moment we know if there is a blood count test which has increased, there's a dengue cases which gonna come now, and it is there on a website which we published it. But if I can get other parties offline data which is there with the retailers and all, I can be in a position to much more predict that. And that is where I see the value of data. So it is always, it's kind of a necessary evil. It is just, if we are able to tame it, can be used in a much more useful fashion for the consumers.
Great. I think so too, because I think the way we use data is digitization is the future. So digitization of data would help in machine learning, will help in AI, will help in integrating. And then that smooth transition from machine to human, that will be the key. How do we do that? There are many ways where we can have the leverage worked. Insurance companies can work with her and her app that these are the fit profile and you can reduce their insurance claim. And there's this fat guy next to her whose insurance premium should rise. You know, so data can be leveraged in many ways, and the key will be how do we make a smooth transition from, so that humans don't become slaves to data, but we leverage it, we analyze it, and we use it in a proactive manner. You know, if a doctor can use 200,000 patient treatment plans at the tip of a button to see them, to apply it to a patient sitting next to him, that will be quality healthcare. That will help us divide this gap between accessible healthcare and no healthcare. So I guess time will tell us, but we all must play our part to see that we collect data, we do it in a regulatory manner, and we use it in an ethical manner for the benefit of the consumer.
Just like what used to be the case a decade or a half back, even today, all the kinds of different services that we're talking about, they may end up creating data silos. Now, another challenge which may come, which is actually coming in a way, how to connect these information or data silos. So, to which I very strongly believe that the data creator has to be the user himself, on his own kind of passbook or an account. Yes, health book, whatever life log, whatever we call it. And that life log or that booklet, that online digital booklet, should actually be pulling their own data from the retailer, from the healthcare provider, from the fitness service provider, even from the beauty or lifestyle service providers. Maybe clubbing it to nutrition, maybe clubbing it to lifestyle, maybe clubbing it to with activity, sleep, everything all together, and delivering some distinct value to the common man on ground who's not unwell, who's okay. That might probably be it.
The PwC survey is confirming what many of us believe in and some of us don't, that technology is not a final destination, it's an enabler. So how do we use technology in our country? What is the challenge my panelists think there are in expanding and scaling up our respective services? We know that large percentage of India yet doesn't have access. We are getting our act together in our respective companies in tier 1, maybe tier 2 also. But that's just tip of the iceberg. So I like to hear from you, looking forward, what help would you need from the government? What challenges you face that your service, all our services become accessible to a guy in Bodh Gaya, or to a guy in Kashmir, or to somebody sitting in Trivandrum, or 100 kilometers out of Trivandrum. So two things I'd like you to ponder and answer about. What challenges you see going to tier 3, tier 4, and what help would you want from the government? So that we use this forum to communicate to the world that this is what we need. So maybe any of you, would you like to start, Vikas?
There are a vast number of challenges, and technology adoption being one, infrastructure, population insurance. You pick up any of the areas and you'll see challenges. And I think I'll just speak about two things. One is the population and the urban-rural divide. We have 3/4 of our doctor population serving 1/3 of the population. So the skewness is very vast when we talk about tier 2, tier 3, and then when we go beyond that. If you look at the availability of hospital bed per 1,000 patients, it's at 1.1, which is below any of the BRICS nations you talk about. The GDP investment from the GDP share of healthcare is again one of the lowest. Now this goes on to say that we have to increase investment from the government side. We need to increase public-private partnerships in this sector and bring technology to service the 2/3 of the nation which is not able to access quality doctor or who has a real problem accessing basic primary healthcare because of affordability, because of understaffed situations. And what it happens is aggregates the problem. So today I have a minor or a edge of a situation where I have, diabetes, for example. I may be at an edge of being a diabetic or a pre-diabetic at this stage. Now, had I had access to a service like a FitPass or a service like with nutrition counseling, which can help me maintain it and not go into a diabetic condition, we have reduced the burden which gonna go on the secondary care, tertiary care. Now, how do you enable that doctor which is there in an urban population where he can reach out to patient who want to reach out to him in an urban setting using technology? The other is how I can ease the burden of a hospital. If I can have IoT devices, and then there are multiple technology which can be used. If I can have IoT devices or whatever, where remote monitoring of a patient health can be done, and I can free up a bed in the hospital and give another person a chance to use that. That's something again helps. You see, there is 32-day waiting time for a person to get a treatment done at one of the government facilities, and that delay aggravates the problem. So how can we enable these technology to come in and be enablers for a better treatment to the patient? The challenge is adoption at the doctor level, the patient level, and the infrastructure as a whole. The second area is insurance. We hardly have 3 to 5% of insurance, health insurance cover in the country. The out of pocket spend for a consumer, which amounts to 60% today, it's a huge burden, and that again limits person to actively participate in health. If the government can help reduce these two burdens, I see a preemptive measure from the consumer to participate in health can significantly change how 5 years down the line number of patients we see in hospital, how healthier our population is, and more importantly, morbidity rate, which we are going to measure. So these two measures, I think, are going to change a lot and impact significantly.
I really appreciate your optimism. Not many will share that government is doing much to ease that burden, but let's see what the government does. Government, we know, doesn't have the resources to provide healthcare for every citizen. Now it has to work either in a private partnership model or in a subsidy model, but government right now doesn't seem to be ready. That all service providers like us who are trying to help out the public or improve access, we are yet have to pay GST. So that was a big request we made to the government, that those who feed the hospitals in any which way or touch that, delivery should be, because otherwise we are increasing the cost of the hospitals. So why are medicines under GST? Why are providers to hospitals under GST? Anyway, I should like to hear more from others.
I'll slightly paint a rosier picture here because I've seen actually over the last couple of years how technology is actually making a positive impact, and some of the work, in fact, companies of our current panelists are doing. Just to quote a couple of examples, I was in Varanasi a few months back visiting a really, really tiny hospital. I mean, it was run practically by an NGO. Very interesting for me there was that there was a small pharmacy in that hospital, and believe it or not, with a poor internet connection, the pharmacist sitting over there was finding medicines on 1 mg. So kudos to these guys. I think they've really made a tremendous impact, because beyond the metros, now technology or service providers like us are actually having an impact. I think the second example which I would like to quote is you mentioned about Kashmir. There's a sizable population that is using Beto in Kashmir as far as Baramulla, and I think that's the impact a holistic and virtual sort of platform it can actually have, because while the government may take its time to find solutions and consensus and be wrapped up in all that bureaucracy, I think people like us who are here, who have left potentially our cushy jobs, and we're trying to make an impact. I think we have a responsibility to participate and make sure that the solutions that we're coming up with, especially in the industry that we are in, are not limited to the metros, because there's only limited impact we can make in the metros. It's actually the wider audience that who we have to find the solutions for. So I think most of us sitting here, I think should take this as rather an opportunity and not just focus on the challenge here. And there is a lot of impact. And coming back, I think while we create these solutions, I think it's imperative that we don't overwhelm the user with technology. I think a classic case for us, for instance, when we started out with Beto, we came out with a really fancy app, a lot of technology, chatbot, etc., etc. We found people were not really using it. So we really went back to a mix of offline and online interaction, which I feel for the Indian population is still must, because the human touch and the compassion, especially in the healthcare domain that we operate in, cannot be underestimated. So that those are just my 2 cents.
Very good. I think I will reiterate the 2 points, that as long as we keep it, there is speed, there's convenience, there's information and friendliness. I think that's the way to leverage technology. And of course, there is an opportunity. In one area, the government is helping us. They are supporting and encouraging penetration of internet. Today, growth of internet penetration is happening beyond tier 1. And that's what all of us can leverage. So it will be 4G and 5G and digitization which will help us.
Agreeing with both their points and adding to it. So this was the first time that fitness was included in healthcare in the budget. It was actually at least picked up as a topic that, okay, this is something that we should look into, because 2/3 of India's population is under 35. And we, on one hand, keep saying we're a growing economy and this is what our future is. Our future is going to be better. But if we're all going to be unfit and not focus on our healthcare, we're eventually going to be an unproductive economy, and we're not going to actually be able to reach the heights that we are meant to. So I think one thing of combining fitness with insurance, like you mentioned some time back, is something that is really important, because the minute you start taking care of your health and you're investing in yourself, your insurance premiums are lesser. Life just gets better. And like there are jokes around that if you think fitness is expensive, you should really try illness.
Interesting viewpoints. The question was, what can government actually do to help the entire industry as a whole? And I'd been actually thinking about that for a while. So there are 2 parts to it. First of all, we all understand and we all empathize with the government, that our government is kind of crunched on resources. They really cannot take care, I mean, technically end to end for the massive population that we have. So what can really government do? This is what I was actually thinking about. There are 2 parts to it. One is about imparting healthcare to people who need it. Now over there, I think what government can do from their side is they can promote a lot of Indian in-house, inbred innovations, so that the cost of the healthcare can come down drastically, or at least all the forex that we lose on importing drugs and medical devices, equipments, etc., is saved back within the country. The same capital can then further be used in insurance, infrastructure, etc., etc. The other piece is about how do we prevent our massive flux of potential ailing people. So, like Beto is foreseeing diabetes, India to become, and which is actually true also, as per a lot of reports, that India is actually going to become a diabetes hub. Now the point is, how do we prevent that in next 3 years? 3 years is good enough. Ayushi would agree that within 3 years, all the pre-diabetics can actually be stopped, can actually be prevented from getting into diabetes. Major bulk of healthcare load financially is actually due to NCDs, non-communicable diseases, which is primarily diabetes and cardiac and diabetes. Governments on one side can promote a lot of India homegrown innovation, adopt them to reduce their costs, and on the other hand, they can actually spend on a lot of advertising, a lot of branding, a lot of campaigns around the issue of poor fitness, poor wellness, increasing load of diabetes, hypertension. When I go to tier 2 cities, tier 3 cities, I still find there's a major gap in terms of mindset. They still do not understand BMIs. People still do not understand what should be the waistline, etc. So these are very basic things that they should probably run campaigns around, like the way they have done, like the way they've done around AIDS and condoms, etc. On the third aspect that may probably come later is about how do you then again incentivize, or how do you motivate the youth, which is going to be the next set of so people in the age of 2025, which will after 5 years or a decade, they will get into the position where they'll get into the age bracket where they will start turning pre-diabetic and then start adding load on the healthcare. How do you sensitize this demography to become health conscious, health aware right away, right front? So this is I think what government
Good.
will do.
So that's a very good one suggestion you made, that let the government encourage the make in India and do some import substitution.
Actually,
You know, so
inventing in India is far more important because
the
making is easy.
The inventions are happening. We need the government to encourage those inventions. I think both you guys are doing inventions. You know, so inventions are happening. We need to encourage the inventions. But the other point I like to add is today government is the largest payer of medical bills through its various programs, whether it is CGHS, ECHS, Rajiv Gandhi scheme, now the new health insurance scheme, and the various other programs. As long as the government can implement them with integrity and in time, I think a great percentage of India's population is served, even if it's served through private healthcare. I'd like to introduce Mudit to the panel. Mudit, the question we were discussing was that many of us have got our act together, getting our act together in Tier 1, Tier 2. What challenges you'll face from your perspective to go to Tier 3, Tier 4? What help would you like from the government?
I'm the co-founder of Curify. Curify is only doctors network where there are about 220,000 doctors, only doctors who discuss medical cases on the platform. Surprisingly, on our platform, 50 to 60% of the doctors are actually from Tier 3, Tier 2 towns. So it's like a 50-50 ratio, I would say, Tier 1, Tier 2 and Tier 3. We actually got to a very big reason on this, and we realized that there is a big role that government could play here. And the role is, what we felt was, there is a huge infrastructural issue in the country today as well. When you go to villages, when you go to Tier 3, Tier 4 towns, people get sick not because they don't have money. I mean, there is definitely a section who don't have money, but there are people who have money. But the problem is, there are no doctors in villages, in Tier 3, Tier 4 cities. So that is why, this is the reason that there are lots of doctors who are the RMPs, the regional medical professionals, who put in medical cases on Curify and then the cases are solved. So my point here is, there has to be a standard of living that has to be set in places which are in villages, in Tier 3, Tier 4 towns, so that doctors are incentivized more to go there. Even if it could be even higher salaries or something, so that the healthcare could be taken care of right then and there, rather than them going to, let's say, cities or larger towns, which most of the people in the villages and smaller cities do. So that is one point on the infrastructural part. Second point, I definitely feel that government is working in this area, because I myself belong to a very small town called Guna, which is our Tier 4 town, and I've seen that the government hospitals have definitely seen a huge upturn in the last 5 years. On the infrastructural part and on the people who have money, this is the point. On the people who don't have money right now, I think very rightly said, leveraging technology is really important for them. Jio is playing a major role, and I think they are doing a very good role in terms of SMS. So in my state, there is something which is introduced in which if a pregnant woman is having a problem, then she has her own BHAI in that particular village. So that particular BHAI just interacts with the doctor who is in the city, and that is being solved. So I think these type of initiatives which help people who don't have money but still have access to healthcare, technology can definitely play a major role. It could be app, it could be any platform, it could be SMSs, and I think this is how the first 3-4 years should be mostly focused on the infrastructural part, and then I think leveraging technology would make a much more sense, because you get access to healthcare in a wider way.
Thanks, Mudit. It's not that nothing is happening. There are snippets of excellence you see. So Karnataka government has completed and covered every family in Karnataka with a EHR digitized card.
Yes.
You know, so Rajasthan government is launching the government portal in the next 1 or 2 months, where all documents, health documents, can all be interspersed at the portal with a unique ID. So there are things which are happening, but I think our country is so huge, the problem is so complex, that we need to see a movement behind it.
Yes.
And simple sporadic initiatives of excellence from individuals, say 100 parties, may not be enough for our country.
I actually want to add something to that. So when the new government had come in, they always started with Swachh Bharat, Swasth Bharat. So first 3 years they focused on the Swachhta aspect, and now they're actually going into Swasth. So if you see any ad, any government related ads that are now coming out, they're telling you that fitness is important, whether it's a BSc ad or any ad. And otherwise also, if you look at any advertisements on TV, be it a razor ad or be it honey, be it salt, every ad individually is also telling you that, okay, fitness is your next big step. That is how you're going to prevent. That is your preventive healthcare.
Moving on, as we discussed, one important topic which we need to be aware about, and I'd like to hear your views, is about what do you see happening in our industry around convergence or around consolidation. And when I say convergence, it could be that, a few years from now, many of our services can be clubbed together. The consumer's phone is anyway overloaded with the amount of apps he has, and the common man says, okay, I can only keep 2, 3. But then we are also seeing that everybody is coming out with the aggregator app. So, now Jio's got a health hub of its own, and they want all of us to be on that health hub. So like this, so there's a plethora of things happening. So will we confuse the common man? Will we finally come to convergence? We have seen that convergence happening in some other sectors, whether it is taxi, whether it is hotels, so in fashion. So will it happen? How soon? I don't know, but it may be sooner than what it took other industries. Because in India, all of us learn a little bit and then leapfrog very fast. First we see somebody took 10 years to do it, then we do it in 2 years. So what do you guys feel? I'd like to hear about convergence and consolidation.
In my view, healthcare is still in its infancy in India, and healthcare as a sector, it's a very vast world. There are many subsectors into healthcare, and each of them are very, very important. So from fitness to prevention to diagnostics to wellness to hospitalizations to networking to data to e-retailing to a disease management care, etc. Each of these are very, very different cases or use cases in healthcare, very diverse from each other. But as I said in the beginning, definitely the convergence has to happen. There has to be a unified platform. I think we are a bit far away from that place, because the individual services are yet to mature, are yet to get to a point where they become relevant, first of all, for consumers. And once that happens, then yes, the need for simplification of multiple services that people uses will probably start to emerge, and that is when probably the consolidation will actually happen.
So here's my view on how healthcare is evolving in the country. So what happened initially, I feel people started thinking from their own perspective, and I think one of the early movers were 1mg, Practo, and they came in from a patient perspective. So what they thought was patient is the patient-centric system of healthcare exists in the country, and they started with a very basic transactional model, which was, let's say, start with booking appointments, or let's say from a patient-centric model. But when they started doing that, they realized that for that to happen, you have to have the other major player in the ecosystem on the digital platform, who were doctors. So then they started digitizing the doctor part, which is the EHR systems, or let's say the EMR platforms that companies have started building. So post that, they started building electronic medical records platforms for the doctors. And then this whole clubbed in, where patients could book appointments and doctors can digitize that on their own platforms. And at the same, on these, parallel, it was running on transactional things for medicine buying and for medicine viewing. The discovery was coming in. So for example, how generic internet evolved was, first of all, discovery was a major use case. So Google came in. Again, similarly, healthcare evolved. Discovery was the major use case. 1mg came in, Practo came in, they searched for doctors. And then on the other part of the ecosystem, doctors started digitizing themselves, etc., etc. And post that, we went into luxury services, which I would say fitness transactions and going on. So that's what is going on as of now. Going forward, I think consolidation would happen in the sense that definitely users would have to have maximum 2 to 3 apps, because this is a play of frequency and transaction both. If you only have a transactional app, I think people would not keep it on their platform or their phone. But if you have a transaction and frequency app, I think definitely they would keep in. That is why players like 1mg and Practos and others are actually moving into various type of services so that people can keep their app. It could be booking appointment, it could be medicine buying, it could be keeping their records on the platform, etc., etc. So they have to have multiple services so that people use their app. Very recent study told, a very famous study, I forgot the name, but it said that if you don't open your app at least 5 times a month, and if it's a transactional app, then you have to have 5 transactions at least. It could be medicine buying, or it could be doctor appointment, it could be doctor conversation, or it could be telehealth, anything. You have to have like 5 times usage of the app in a month. So going forward, I think from now 5 to 10 years, consolidation is definitely going to happen. There would be 2 to 3 apps who would have all the services. Users would use it. It could be through integration within their platform, or it could be something which they would build from scratch. One example is Curify itself, because we have been bought very recently in October 17, because we were a doctor-focused platform. So this is one of the major services that any particular buyer would think of, that I would have all the gamuts under control. It could be fitness, it could be doctors, it could be telehealth, it could be doctor appointment, etc., etc.
Thanks for crystal gazing. And I like to hear other people's views also.
So I would like to add that fitness is not actually a luxury, it is the need of the hour, because you're not, India doesn't have the luxury of actually working out on, na to har colony mein park hai, you can't go to a park and work out. The weather is not conducive enough for you to do anything, and there's no facility available at home for you to work out. And going to a gym is expensive, which is why we're breaking that and making fitness convenient. So even right now, because all your phones have some sort of an health app, clearly 2 of you are wearing fitness bands. So there is something that is tracking what you're doing, and that is where one amalgamation is right there, because for you to know what steps to take next and what to do in your fitness, we need to know how much activity you're already doing. What if you have any ailments, anything, if you are going to use my AI-led training plans, then I need to know that, okay, do you have any issues? Because then I will not suggest that workout to you. If you go to a gym, your trainer will also ask you, okay, do you have a backache? Do you have any problem in any bone? Do you have, and my nutritionist will ask you, do you have any hormonal issues? So at the end of the day, this is your health information is required for you to be able to take your fitness forward. You're only going to be able to do better in your fitness to prevent anything if you already know what might happen and what if you're taking care of your body. So there is already an amalgamation that is begun. So there is that eventually there will be more things that will have to keep getting added if you've had an operation or anything else. So, but at this point of time, like he said, we still haven't matured enough to kind of amalgamate and become one product, but we're all getting there. We are growing.
I think the good point you're making is that this awareness and individual education will rise proportionately to convergence. As the consumer becomes more and more aware of different services and begins to consume them, it'll speed up the convergence.
Just a point here. So we didn't start as a transactional app. The approach was always a holistic health, and the first step was information, and then we moved to other steps. So discovery was the first step, right? So important to understand here that consolidation is eventually a natural evolution of any industry. If you look at healthcare or any matured market, that's the way it has done. Let's look at India's example and currently where we are. It's a 2-tiered thing which is going to happen. One is at a patient level, where he will see that all my healthcare services are under one app, roof, data center, whatever you want to call it. And then 2, at a holistic society level, where all this individual information is collated, consolidated, converged into insights, which I can throw back to the society for overall development. And that can be a government move, that can be a healthcare which has become so large, or there can be a natural neutral platform, which is from the convergence of the top players. Now, try and understand that how the journey of a consumer in healthcare today moving. It's going to become much more digitized, it's going to become much more personalized, and it's going to become much more data driven. Now, if that has to happen, all the individual healthcare elements which he interacts with needs to come on a single platform, single space, single format, and accessible to the healthcare provider, if my doctor cannot access my data, that how many fitness elements I've taken care, what elements I've taken care to control my diabetic, or how regularly my medical adherence has been, or what is my last diagnostic test, it eventually going to lead to much more time duration which he spends with the patient gathering this information. If he has a summary there and then he starts at a discussion with the next level of the patient, that's going to benefit in each and every respect. So that is where I see convergence of information, especially around healthcare for the patient level. Now, if you are able to do that, the biggest challenge I see today, there is no common format, there is no common way of integrating that data, and the way it is being generated, and like Amber mentioned, that we need to incentivize user to upload their information or become a become a much more active participation in that. The biggest challenge is there is no single format which is available. There is no single entity which is defining that this is how, if a prescription is generated, this is how it should be captured. There are different fitness bands, fitness applications which are running, and there is no common format in which the data is stored today. So even if you talk about AI to come and play a role to decipher and become much more proactive in predictive health, it's not going to happen. We have to define those basic steps first. Then comes the next part, that if at my level or at a consumer level, I've been able to define a health data which is holistic in nature, how do I engage each and every individual or each and every provider in this country to give this data to draw insights and lower the burden of healthcare cost, or helping in defining a better disease management program, or predict an outbreak of a disease. And I think few of the steps already happening. It's just that it needs to happen at a much more larger scale. So yesterday I was discussing with someone the Rohini initiative which is there. So they're going to come up with, and that's one of the suggestions I heard that's going to come, that today it's a repository of the healthcare service provider, the hospitals, that any element of patient costing which they have earned, they have to publish there. Now, if you have a repository which gives you clear costing, a knee surgery within a tier 1 hospital and a tier 3, if there is a huge, in fact, in tier 1, if you have 10 hospitals which has a knee surgery from X rupees to 10X rupees, that will become much more stabilized and much more relevant for a consumer to make a decision. And it's going to take time, but consolidation will happen.
Okay, good. Thank you. I'll just like to react before my other panelist says. We have to be careful about this convergence of information, digitization, and data. And we should learn from other companies. As it is, we are flooded with jokes in the last 2 weeks about what all Google knows about you. And, so that we all know what's happening there. But if you look at the UK model or the US model, in the US model, if I'm insured, everything is so digitized and information is so centralized. I can't go to see a doctor till I don't check with my insurance provider. Which doctor do I go to? So that's one thing. If you take the NHS model, they took in so many people that somebody has to wait 60 days for a normal procedure to happen. So then we have to be careful that with this centralization, cartelization, if I may use the word, of information, do we go that way? One reason we may not go is our ownership pattern. Our healthcare system is essentially private owned. So when you have private ownership and it is for profit, unlike the UK, unlike the US. So here, one hospital system, X and Y, we will not share the common format, because the X system may consolidate a lot of small providers and become huge. But that system will not share with Y, because we want to keep our patients in our ecosystem. What may be better? You said another thing about price sharing. See, government prices are known. In the private sector, there are people like Credit Health. Today we have 5 million price points with us. It's less. But we yet have accumulated 5 million price points. So now we are in a position to tell consumers and insurance companies that, okay, if you want a simple angiography done, this is the range in this city. So there will be providers like us who will collect data, who are collecting data, and then will be able to analyze it and then give it back to the public or to the insurance provider to manage cost. That is one kind of consolidation. But the other would be what you see happening in the industry around us in terms of ownership consolidation. That time will tell.
Yeah, I think, just adding to that, because I think if I look at most of the panelists here, we are perhaps the new age healthcare industry. I personally feel that we are really scratching the surface, whether it's these guys or us. It's really the start of the ecosystem as far as I'm concerned. So consolidation among us perhaps is a few years down the lane. What I feel strongly about is though the ownership question that you raised, because indeed that's actually the offline part of the healthcare industry, which is perhaps now beginning to gear up, where essentially some part of, I mean, we hear about, of course, that's for different reasons, but Fortis and Manipal happen and so on and so forth. But I mean, this is the wave because, for example, Columbia Asia, right? We're talking about data integration across hospitals. Now, I can't believe Fortis and Apollo sharing data, but Columbia Asia, with their approach, is actually building an aggregated platform of hospitals where care and data can be exchanged. I think that's a reasonable model as we progress, whether it's also, I mean, Cygnus OrthoCare and so on and so forth. So these chains of offline clinics where data can also seamlessly exchange. I think that's where perhaps today some form of convergence can begin. I think as far as I'm concerned, too early for us because we are still, you know, there are so many different experiments you guys are running still. We, of course, are relatively new. So I think we are still figuring out the problems that we are going to be solving. Most of us are still, in terms of our bulk audience or the target audience, we are still focused on the metros. We are slowly getting into the tier 2, tier 3 cities. So it's still early days for, I feel, for this panel. But certainly when we look at the offline model, there's significant convergence that needs to happen there.
Okay, good to hear everybody's views. So I think at this point we should not stretch. I think we run out of time. So maybe we should meet a couple of years later and see that which one of our crystal gazing was more accurate. Thank you, folks.